I call Monica Lennon to be followed by Alison Johnson. Please, Miss Lennon.
Thank you, Presiding Officer. I'm grateful for the opportunity to speak in this debate today, and I add my appreciation to the Public Petitions Committee for their work on this important petition this far. But most of all, I'm grateful for the incredible bravery and strength of the mesh survivors in Scotland, whose tenacity in campaigning to raise awareness of this issue has led us to the point we are at today. Like I believe, all of the MSPs in the Chamber, I am totally in awe of the strength and the passion of the women I've met who are part of the Scottish Mesh Survivors group. Earlier this year, I joined parliamentary colleagues at a meeting with the Scottish Mesh Survivors, organised by my colleague Neil Findlay, who's been a long-time champion for the voices of the Mesh Survivors and has done some excellent work in raising awareness for these women, as have several other MSPs from various parties. Nothing can prepare you for the stories of these women. I can only imagine the pain that they have had to endure over the years. But I share their rage that this has been allowed to happen to them. All of the Scottish Mesh survivors, ordinary women with ordinary lives, have had their lives turned upside down by the implantation of transvaginal mesh. Intended to address incontinence or pelvic prolapse, the insertion of polypropylene mesh was for many of these women a procedure they had been led to believe was first class, safe and would make their lives better. For so many of the women who have undergone these procedures, this could not have been further from the truth. As we now know, in many patients, the mesh began to break up, dispersing fragments throughout these women's bodies and causing incredible damage. Some of the women I met earlier this year told me about ruined relationships and careers, the daily struggle of having to live with chronic pain, the loss of the full use of their legs, and the unbelievable pain of having to deal with how these changes have utterly changed their lives, shattering hopes and dreams for the future. The implantation of mesh implants in women across Scotland on the NHS is a national scandal, and the way in which these women have been denied, first by their doctors when these women expressed their concerns, told that they were imagining or exaggerating their symptoms, then by the big medical companies, and now by governments tasked with investigating this whole debacle, it's nothing short of an outrage. During the drive to get MSPs to sign up to the Say No to Mesh Whitewash pledge earlier this year, one of the women I met with told me about the experience she had when she first started having problems following mesh surgery. Her surgeon repeatedly told her that she was a unique case, the only one he had ever known to have been experiencing these adverse side effects. And for months she was none the wiser. It was only through the discovery of the Mesh Survivor group and discussion with other women who had gone through the surgery, some with the same surgeon, that she discovered this doctor had been telling several other women the same thing. It's an absolute outrage that these women's health have been put so terribly at risk through this procedure, because not only is the implantation of mesh unsafe, but some practitioners and medical companies who advocate the use of mesh have clearly known about the dangers and yet have been complicit in misleading women about the dangers and effects. Earlier this year, a few of us launched the cross-party group on women's health. I'm the convener alongside Alison Johnson MSP, who is the vice-convener. The purpose of the cross-party group is to inform Parliament and policymakers on a range of health issues which only, predominantly or disproportionately affect women, to consider the impact which gender and inequalities has on women's health and their ability to access health care and treatment, and to empower women to make informed choices about their health and ensure they are treated with dignity and respect. In large part, the discussions I was having with a range of groups as my party's inequality spokesperson sparked the need for this group to be established, and the experience of the women from the Mesh Survivors group absolutely played a role in the desire of these issues of women's health to be looked at more closely. The way in which so many of these women have been brushed off and disbelieved is outrageous, and it should never be allowed to happen again. These women deserve justice. So I echo the calls of my colleague Neil Findlay that the mesh scandal must be investigated with a judge-led inquiry that is truly independent of the Health Service and the Scottish Government, and I urge the Cabinet Secretary for Health to give this serious consideration. As a 2016 MSP, I'm fairly new to the parliamentary scrutiny of mesh, and I'm struggling to understand how health boards were able to disregard the moratorium and get away with it without any apparent consequence. So I ask the Cabinet Secretary if she can give an answer to that in closing. The mesh survivors in Scotland and across the world have been silenced, sidelined and brushed aside for too long. It is beyond time that their concerns were investigated seriously through a truly independent inquiry and that the calls of their petition are considered by the Scottish Government. I ask the Cabinet Secretary to give that her wholehearted commitment in closing.
Thank you.